Hearing the words kidney cancer is, well, it's just heavy. It can feel completely overwhelming. But I want to start this off with a message of real, genuine hope. Today, we're going to walk through how incredible new technology is really changing the game for treatment, making it safer, and helping you recover so much faster than ever before.
And Dr. Anup Ramani really puts it perfectly right here. This isn't just about fancy new gadgets for the sake of it. It's about a total shift in how we approach patient care. It's all designed to get you back to your life with less pain and way more confidence.
Okay, so let's dive right in. We're going to break down exactly what robotic nephrectomy is. This is honestly one of the biggest leaps forward in cancer surgery. So let's get a really clear picture of how it all works.
So when it comes to the surgery, there are really two main paths. With a radical nephrectomy, the whole kidney comes out. But with a partial nephrectomy, which is what we aim for whenever possible, the surgeon just takes out the tumor itself, saving all the healthy kidney tissue. And here's the crucial part. Both of these incredibly precise operations can be done using the advanced Vinci Robotic System.
A lot of the fear comes from the unknown. So let's walk through the surgery itself, step by step. I want you to know exactly what's happening from the moment you enter the operating room.
First things first, you're comfortably under anesthesia. Then, the surgeon makes 5 very small incisions that act as entry points. The robotic arms are connected through these little ports. And from a really sophisticated console nearby, the surgeon is in complete control, guiding every single movement with this magnified 3D view. It's unbelievably precise.
And it all starts with just 5 incisions. Think about that. Instead of one large opening, you have these tiny, carefully placed entry points. And that detail, right there, is one of the biggest keys to such a fast recovery.
And when I say tiny, I mean incredibly small. Each one of those 5 cuts is just 3 millimeters. That level of precision completely changes the healing process that comes after.
Just to give you a real sense of that scale, 3 millimeters is smaller than the tip of your own finger. This is what we mean by a non-invasive approach. It's all about minimizing the impact on your body right from the very first step.
And you know what else? The procedure is also remarkably quick and efficient. A radical nephrectomy, where the whole kidney is removed, usually takes about an hour. A partial nephrectomy is a bit more intricate, so that's around an hour and a half.
Now, this next stat is maybe the most powerful one of all. Because of the precision of the robot, the surgery is practically bloodless. In fact, not a single patient, 0, has ever needed a blood transfusion after this procedure. That's an absolutely incredible testament to how safe this technology is.
All right, so the surgery is efficient, it's safe. But what does that actually mean for your recovery? Now that the procedure is done, let's map out what happens next while you're in the hospital. We want it to feel predictable, manageable, and not at all scary.
Okay, so your hospital stay is typically just 4 nights. You'll get admitted the night before. The day of the surgery, you'll just rest up with some IV fluids. By day 2, you're already sipping water, and the catheter comes out. On day 3, you're back to eating solid food, and the small drain pipe is removed. And by day 4, you're ready to head home. It's a very clear, very quick path.
And really, this is what it's all about, isn't it? Getting back to the life you love. The entire recovery process is designed to be as smooth and as fast as possible, with clear and encouraging milestones along the way.
So get this, on the day you actually leave the hospital, you're already completely self-sufficient. You're walking around, showering, dressing yourself, no problem. Then, within just 2 to 3 weeks, most people are already back at work. And after only 1 month, you can get back to everything, running, hitting the gym, all heavy physical activity.
And the support doesn't just stop when you walk out the hospital doors. A doctor from the surgical team will actually visit you at your home or your hotel every single day during that initial recovery period. We want to make sure everything is going smoothly and be there to answer any questions you have.
Beating cancer isn't just about one day or one surgery. It's a long-term journey. So let's take a look at the follow-up plan that makes sure your health is the #1 priority for years and years to come.
The plan is really straightforward. You'll have a CT scan once a year for 5 years, just to keep an eye on everything. 2 weeks after your surgery, you'll connect with Dr. Ramani to go over all your reports. That can be in person, or if you're from out of town, through a really detailed phone or video call. You're never on your own in this.
Now, we've talked a lot about the amazing technology, but a tool is only as good as the hands that guide it, right? So why is the surgeon's specific experience in this type of cancer surgery, what we call uro-oncology, so absolutely critical?
It's because an expert uro-oncologist knows that delicate landscape around the kidney. They know how to navigate it, how to save every bit of healthy kidney function, all while making absolutely sure that every last piece of the tumor is gone. That expertise, well, that directly leads to better results, fewer risks, and the best possible chance at a full recovery.
At the end of the day, it really just boils down to this. With technology this advanced and a procedure this precise, the surgeon's deep, specialized experience isn't just important, it's everything.
So if you or someone you love is facing a kidney cancer diagnosis, please know this. You have incredible, world-class options. The path to recovery can be precise and fast. To learn more or to book a consultation, just call the number you see on your screen or visit the website. Because when it's about your health, you absolutely deserve the very best care.